Hi, I'm Cindy. Today I'm going to talk about gout, a form of arthritis characterized by severe joint pain. So, to be specific, I will be discussing its history, prevalence, cause, symptoms, treatment, and future study in this presentation. Gout was first discovered by the Egyptians in 2640 BC and was later recognized by Hippocrates in the 5th century BC. In fact, gout was once loved by society. Many people thought it was an honor to suffer from the disease. But do you know why? Actually, gout's nickname, the disease of kings, suggests the answer. Linking to an intemperate lifestyle, gout could instantly improve the social status of the patients back then. Today, with the universalization of westernized diet and the increasing affluence, the prevalence of disease is on the rise worldwide. In this map, we can tell that gout is quite common in North America, Western Europe, and Oceania, while relatively rare in former Soviet Union regions. Ethnically, gout is especially common in Taiwanese Aboriginals and Maori. Men are much more likely to suffer from the disease than women, and the prevalence rate increases with age. This graph shows the research done in the UK that supports this idea. We can see that the blue line, which represents men, is way above the pink line, which represents women. This graph also shows that there is a positive correlation between age and incidence in both men and women. Now, let's talk about the cause of the disease. Gout is a crystal deposition disease. But where does the crystal come from? To answer this question, we need to know what uric acid is. Uric acid is an acid. It results from diet and the decomposition of endogenous purines and has a solubility limit of about 6.8 mg per deciliter. The increased purine breakdown or insufficient renal uric acid excretion causes the serum uric acid level exceeds this solubility limit. Hyperuricemia will result, and the uric crystal will be likely to form. As shown in the image, gout occurs when sustained hyperuricemia leads to the deposition of the crystal in and around the joint. So, is gout a congenital disease or an acquired disease? Well, both inherited factors and acquired factors play a role in determining the risk of gout. Let's talk about the inherited factors first. You know that gout aggregates within families. A nationwide population study in Taiwan indicated a 35.1% and 17% heritability in men and women, respectively. Specific genetic defects, such as hyperactivity of PRPP synthetase 1 and lack of HGPRT, are thought to greatly increase the risk of gout. At the same time, bad eating behavior can also contribute to the risk of the disease. The health professional follow-up study in the USA suggested that a purine-rich diet, such as alcoholic beverage, soft drinks, and seafood, can cause people much more susceptible to gout. Metabolic syndromes, such as hypertension, heart disease, and diabetes, can raise the risk of gout as well. It's time to take a look at the symptoms of gout. Acute gout usually starts at a joint in the lower limbs, such as the knee, the ankle of the foot, and the big toe. After the rapid onset, symptoms like joint pain and swelling will quickly develop. Since the symptoms can normally resolve in 1 to 2 weeks, it seems like there is no need for treatment. However, this is not true. Many unlucky patients will experience multiple recurrences of gout after the first attack, usually with a longer time and a more severe degree. The upper limbs are likely to be affected in these following attacks. Failure to treat acute gout in time may lead to chronic gout with joint inflammation, joint deformity, and atrophy. As you can see in this photo, a toe fat is a white to yellow hard nodular masses. So, how can we get rid of gout? For the acute attacks, resting, applying ice to affected joint, and taking colchicine can greatly alleviate the symptoms if using within the first day of the onset. Certain therapies are developed to lower uric concentration. They can dissolve crystal deposits for patients who suffer from recurrent gout attacks or chronic gout. Drugs such as verbacillate, uricosuric drugs, and uricase can be used about 10 days after the inflammation subsides. Curry, yogurt, and vitamin C can also help to prevent the occurrence of gout. Today, gout is the main cause of inflammatory arthritis, and it affects about 2% of adults in the developed world. That's a lot of people. In 2015 to 16, total affected population in the USA is 9.2 million. In fact, gout is becoming a global burden. About 90% of patients' conditions remain underdiagnosed or undertreated. Luckily, gout is getting more and more attention. Many new drugs are currently being studied, such as canakinumab for acute gout and arhalofenate for chronic gout. Further study is required to better understand the disease and to help the patients have better qualities of life. That's kind of it, and the next few slides are my reference slides. Thank you.